Hey guys, welcome back. Sorry, we had a little technical difficulty there. So we are going to pick up here talking about giving and receiving feedback on number 6. We were talking about accountability right when the video cut out. So just to circle back here, that something that helps us know we're ready to give feedback and receive feedback when we can hold each other accountable without using blaming or shaming language. And that can be tough, but using questions to learn more about where someone is not comfortable and where we need to dig in or provide information or provide an example or even just take a break. You know, hey, I think we're at a limit here. We're both pretty toasted, and why don't we circle back to this next time? Okay. Anything else you want to say about holding people accountable? I'll say it's really hard because it's really hard.
Because it's not, I mean, you want to say it's not personal, it's business, but you know, and it is in a lot of ways, but it's never received that way. And even if you reflect on yourself, like, do you always receive, you're like, I know they're just trying, you know, it's just the model of it. But it can be hard to give, and it's hard to take. So I think, you know, being mindful of that. And also maybe at the beginning, when you've gone over your learning styles and all of that, I think maybe figuring out how they maybe best receive feedback could also maybe play into this of how to give feedback too on the best way that they receive it, maybe talking about that up front and opening up that line of communication so that it's not something that isn't talked about.
Yeah. And I think about when you were just saying that, Allie, I thought about you did something, it's not that you are something. Like you did something wrong, it's not that you are wrong. Like it's not, you said like it's business, it's not personal. Like this isn't about you and your identity as a core person. This is about a process and something that we're trying to learn. Jeanette, what are you thinking?
Well, I was just thinking that we talk about giving and receiving feedback and what makes giving feedback so difficult. And sometimes those are the areas though that are so difficult. Like when you hire on somebody and you find out that maybe their work ethic isn't your work ethic, or their standards of care aren't your standards of care, and try not to make that seem personal. Those are the areas I think that are so holding somebody accountable that it becomes really hard to not shame or blame. So like, I noticed you didn't give a CHG bath and you had this hour of window of time that maybe you could have prioritized that care. Trying to not make it sound like, I noticed that maybe you were sitting and texting on your phone for 45 minutes and somehow you didn't have enough time to give this patient a CHG bath. How do you give that feedback? Because that's honestly what you want to say. And that's what people struggle with, is when it is a little bit, when it may be a little bit personal. Yeah. And so the more that you can identify very clear areas, to Brene always says clear is kind. And so to say there was a moment in your day when you had some time to give a CHG bath, and I saw you prioritizing other things. Maybe that is a way to say, I'm watching you. And if you're not doing this when you have a preceptor right next to you all day, are you going to do this on your own? And this is our culture. And this is something that we really value in the ICU, to have a clean room, to have and oftentimes saying the reason why it's so important is because at any point in time, this patient could code. So is your room messy? Are your trashes full? Are your lines a mess? I am guilty of this as well, especially when I'm busy, and especially when I have to consciously think to be organized, because I am not an organized person at heart. And so if I'm having a bad day personally or professionally, it really takes a serious conscious effort. And I have had coworkers bring it up to me and say, like, I noticed your room was a little bit messy, you know, can you just be a little bit more mindful of it? And I have to be mindful, and I appreciate that feedback, because that is not who I am as a core person, but I want my patient to be safe and I want my coworkers to respect me.
And you know that they're giving it to you from a place of, I care about you and I care about the success of your patient. And because I care, I'm going to tell you this in an honest way. And it's not because I'm trying to pick on you or bully you or make you feel bad.
Right.
Yeah. That's the most kind way to give it.
This, you're making a good call out, because this is really hard to do. It's really hard. Like at the first part when you're saying, I don't know if you noticed, or, so it's hard to be the nice girl giving if you were raised in a passive pleasing culture. I always say, like, I'm a third generation people pleaser. I was raised by a Midwestern mama that's how she was raised. Those were the communication tools that she was given to navigate her world. And in times they served her well, and in other times they were terrible. And so she never knew how to give really direct, honest feedback. And it's hard because you feel like you're being a certain word that I can't say on a recording, but using your tools and being direct. If you had really good trust relationship with this person, you'd be like, hey, what's going on? Like, why are you doing this? You could be really honest, but you have to do it in a way that is structured, that is objective. I know, like you gave a good example, the CHG bath. Hey, I noticed that you had time to be on your phone for about 25 minutes around 2:00 when the CHG bath was not done. And that's not okay, because the CHG bath is a part of our standards of care. It has to get done. And so I need you to work on that. Also,
what could I do? What can I help you?
Oh,
is there something going on at home that you need to address? Please just let me know. Or is there some way we can, I know I made like a whole checklist for someone who always forgot their charting. And it was like, so I use it myself now. It's like each patient has a block, and it has assessment with 3 squares. And then it has eyes and nose with 3 squares, and vital signs with 3 squares, and education, plan of care, acuity, wounds, so that I can check it off when I'm done doing that documentation. And I don't have to be like, oh, did I do that? Did I not do that? And then if I have restraints, I write that on there, so that it's like, it makes me feel better, because I love to check things off a list. So it's like my own reward for myself. But then also on top of that, like it keeps me, on top of things. I know that if it's checked off, it's done, and I don't have to worry about it anymore. So I think, is that a tool? Can I help you come up with a tool? What can I do to, facilitate you to not forget this? Also bringing that part into it. So being available, showing your orientee that you're available to help them and to try to brainstorm, I think.
Yeah. And that goes into number 7. I'm willing to own my part.
Oh yeah.
Whatever the confusion here, I'm willing to own my part. Hey, I think one of you gave a really great example of this earlier. Just say, hey, maybe I didn't do a very clear job of explaining, but this is how we get back on track. And so let's go ahead and do these things and get these supplies. And do you have any questions for me? Do you have any questions before we tackle this again? So owning our part. As a preceptor, I think this can feel specifically hard because you're giving all the time. You're demonstrating all the time. You're thinking out loud all the time. And so from the giving and receiving continuum, like you feel like you're given everything. That's why you leave exhausted sometimes, like you just gave it all, you left it all out there. And owning our part of what was a misunderstanding or an assumption or confusion is it's different than just giving and giving and giving. It's saying, hey, what part of this did I not explain very correctly, or where did I lose you here? We're not on the same page. You guys have any tips for how to tap into that ownership part of a problem? Or
I think I oftentimes talk about areas that I still struggle with in the ICU. I often talk about areas that I struggled with when I was a new intern. I think the further away we get from those experiences, the harder it is to relate sometimes. So, but there is a few that I always try to really hang on to and try to hang on to that feeling. And then, when I meet my interns, I try to just say like, listen, here are areas that I'm not really strong at. And if I tell you where I'm vulnerable, hopefully you'll tell me where you're vulnerable, and I will do my best to get the resources that you need.
That's good.
Yeah.
I think also asking before you go and do something, I found and this was not too long ago, but I didn't realize a nurse, the skill was maybe thought was there, but in reality it wasn't there. And I guess it was my assumption that it wasn't a foreign concept to them. But once we were in the situation, it felt more foreign than it was. And I was like, whoa, what just happened here? And I think, it felt bad to me because I'm like, oh, I set you up for failure, like not realizing assuming ultimately that you knew what you were doing, when in reality you didn't. And did you not feel comfortable enough for me to say that? Or did I not prompt you enough before? Did we just jump in too soon? So, I mean, things like that happen. And, I think just maybe realizing that not regardless of where the person came from, they might not, on a simple skill that you might think, oh, we all do it all the time, they might not be comfortable doing it or be proficient at it. And just breaking it down, hey, do we need to go over this before we go in the room? What are the steps? And just throwing it out there, opposed to just assuming, even on something simple like dropping a feeding tube, or putting in a Foley. We all do that, but you just never know. And just realizing that not everybody's on the same page and has done all those same skills.
Yeah. And like Jeanette referenced earlier, clear is kind, and unclear is unkind. And so to avoid assumption is hard to do, because that's a part of the trusting thing, is to say, hey, I'm just going to trust that you own this, versus trust is different than assumption. And I think they can live close to each other and get confused for each other. But like, let's go back to the example you just gave, Allie, like, hey, we're going to go in, we're going to do this Foley. And maybe something that I could do as a preceptor would be say, okay, hey, let's just run me through your game plan real quick. We're going to go in, we're going to do the Foley, walk me through your steps real quick, so I make sure that I'm on the same page with you. You can use yourself as sort of like, hey, I just want to make sure that we have everything we need, and I want you to be successful. So, hey, run me through your game plan. We're outside the room. What's the game plan? And they can be like, what are we talking about? Like, we're going to go do the Foley. Yeah. Okay. Tell me the steps. What are you thinking? What are we going to need? Oh, she's a big person. Oh, he's a big person. Oh, we need another person to hold a leg. We need a person to hold the panis. We need, what's your glove size? I'm going to get you an extra set of gloves, You
have your graduate in a stat lock, because the one that comes in the kit is terrible.
Yeah. Don't assume. Ask questions. I think
it was a reflective moment for me. And I was like, oh, I assumed that. Not that, and it was nothing bad. I mean, it was just happened. And I think just being mindful that, it might seem like you're taking baby steps, but I think it would rather be that way than getting in a situation where everybody kind of feels unprepared and then getting in a frustrating situation, like, just kind of getting it out in the open to begin with, I think is helpful.
Yeah. And to avoid them getting into an unsafe situation.
Correct.
There's a patient involved here. So we are there to ensure that things are done in a safe way. Yeah. All right. Good stuff. Lots of good, hard things to do here on the backside of this checklist. All right. So number 8, I can genuinely thank you for your effort rather than criticize you for your failing. This is something that I think with practice and even just with awareness, you can do well. I was talking to Allie about a moment that, we had a learning moment together when I was teaching something new that Allie had never done. And even though the event didn't go perfect every time, because, you got to do this a couple times. It's a technically difficult skill. After we would get out of the room, I would say, hey, so I know we didn't land that, but you did the setup really well. You did the prep really well. You did the assessment really well. I saw you looking at these things, and I called out the components of what part of this competency that she did really well. And even though the outcome wasn't what we wanted, that's okay, because learning happens at every part of the process. So I felt like that's That's something that comes to mind when I think about number 8, that I can really give a genuine recognition for effort, rather than being like, so that didn't work, let's try it again, without giving any sort of feedback. Okay, great, it didn't work. God, I got to do that again. Shoot.
Yeah. Or I'm a failure, or I can never do that right, or boosting confidence again, I think.
Yeah. So affirming what they do well. And if they're an intern that gets into a negative spiral of thinking, oh my gosh, I can't believe I blew that. I'm always blowing that. I'm never going to get this right. I should have gone to like truck mechanic school. What am I thinking? I can't be a nurse. You know, they start getting into this really bad way. If you notice that about them, then you got to utilize this tool, because you got to keep them built up. What you got?
Well, I think the idea of thanking somebody for their efforts, I think about that now with our new IV pumps, how long it takes me to process, to work through the steps of doing the IV pump, and like how much I overestimated how automatic the Alaris pump was, and how quickly I could like program in a bolus and do something really quickly on it, and how much time that saves me throughout the day. And so when you have a new intern coming in and everything, they have to think through every step of everything that they do, and nothing feels automatic anymore. And they run behind in time. And so then their charting is off in time. And then they like, their time management isn't up to par, to feel like, oh my God, I'm so bad at time management and I can't handle being an ICU nurse. But really it was, they were just putting in so much effort and they were trying so hard. It's just, everything takes that many more steps for them to do, because things that come automatic to us are not automatic to them. To be like, you actually you're doing really well. You still need to work on your time management. But once these X, Y, and Z things become automatic to you, you'll find that you will have enough time in the day to be an ICU nurse.
Remember what it's like to be new.
I really like that example. I just wanted to once again, thank you. That's great. No, that for real. Like these pumps, you know, they're just driving us crazy, and it takes 100 years to program it. Like, yeah, I could have made the drug and, you know, started the line.
Could have gone out and grown the leaf and then ground it up into a powder, diluted it.
Yes. So you feel like it's like, oh my gosh, what am I doing? I don't know how to be a nurse because I can't program these flipping pumps. But it's this, that's exactly how people feel when it's new, is like us dealing with these new pumps all the time for the first until they start to get comfortable. I think that's a great perspective to put yourself in that's very relevant right now for all of us.
Totally. Absolutely. And then another thing I want to say about thanking for the effort specifically is that even if, you know, the outcome is what it is, you know, they're struggling, something didn't go right, a lot of things didn't go right, I don't know, but they came and they tried. And when you acknowledge that you appreciate their effort, you know, that it's so important. They came and they just gave. And if there's nothing that they get as feedback for being like, hey, I see your effort right now. I know this is hard. Stick with it. You're going to get it. I promise. Just keep trying. Keep coming back. Keep, you know, they need that, because, you know, we all come to our place of work and we, you know, we give. And so without anyone ever acknowledging that and seeing that over the course of time, you feel invisible and you don't feel seen and validated, and it sucks. So even just that, acknowledging the effort, separate from the outcome, separate from the success or failure. That's good. And we love our infusion pumps, don't we? Okay. Okay, number 9. I can talk about how resolving these challenges will lead you to your growth and opportunity. So I can keep it focused on a positive outcome, a light at the end of the tunnel, you know, hey, you know, more time with these pumps and we're going to get more comfortable. We're going to get more familiar. We're going to identify more feedback for our clin technology folks to help us out with, you know, we're going to, you know, whatever it is. So I can talk about how resolving the challenge in front of us is going to help you. So I keep it in a good light, frame it up, and keep it in a positive space. Yeah. Number 10, I can model the vulnerability and openness that I expect to see from you. This is so key. It's that role model, preceptor role. it's not easy to ask questions, to be wrong, to be new. Nothing is familiar. Nothing is easy. That's hard. That's what it's like every day for a new intern. They're new to this crew. They don't know where the supplies are at. They don't know how the theme and the role of the day is going to go. So they don't know how to manage their own energy. They're nervous that they're going to mess up. They're nervous about what you think of them. And they see you as their preceptor, coming in. Hey, I'm so-and-so. I'm your preceptor. Hey, these are the things that we're going to work on today. You start framing up the day for them. These are the things we're going to work on. We'll get to a whole bunch of that other stuff later, but for now, let's just focus on these things. And, my communication style is this. This is how I, receive and give feedback. Is that okay with you? What are the ways you give feedback? How's your communication style? What's your personality style? And then they see you role modeling, referencing things, looking stuff up, saying, I don't know, asking a colleague for help. What are the other ways that we can model that vulnerability for our interns?
There's at least 2 stories that I share with my intern. One is my mid-air when I was new in the ICU, because I don't want to see people repeat it. It was with a neosynephrine stick, because it looks just like an epi stick and you think you want to give a lot of it and you really only need to get little whiffs of it. And I share that story, because I think it's an important error to be mindful of and to not do. And then I also give an embarrassing story about how we were giving platelets to a patient, and I was teaching my patient about platelets and I taught it wrong. I taught it like it was plasma. So I had this moment where you're just thinking about so much stuff and my preceptor was really gracious and he kind of just slowly stepped in and corrected what I was saying. And in the moment I realized what was coming out of my mouth and how I was teaching it wrong to the patient and what we were giving them. And he did it he interrupted me and it was something that I had been a nurse for 6 years and I should very well know what blood products do what to a patient. But you have such tunnel vision that sometimes it's hard to remember all the things that you actually know. And I like to give those 2 stories because one is a very important lesson to learn and I learn from my mistake and that mistakes happen and that we have to be open about them and honest about them. And then one about this is really embarrassing and this is going to happen to you and probably. You're not expected to know everything, even things from when you were a nurse, since you've been a nurse for so long. Sometimes you just get tunnel vision or your vision gets cloudy or your thoughts get cloudy. And there can be embarrassing moments when you are going to think that I expect you to know something and I don't expect you to know everything, even things that you should know from being a nurse from this long. Because that's really important that a nurse feels comfortable to understand that it's okay that you don't understand ABGs, even though you've been a PCU nurse for 3 years, in the extent that I want you to know them when you're in the ICU.
Yeah, totally.
Or you need a refresher because it's become automatic to you in a way that you understand them, but you have to understand them in a different way here.
Yeah.
Because it involves vent settings or whatever it may be.
Yeah. What are you thinking, Allie?
Oh, I was just going to say yeah, I try to always start with someone that kind of a little synopsis about me is, my name's Allie. I tend to talk fast and walk fast. So please slow me down because it can be overwhelming. I can't help you unless it's only it's a two-way street here. I don't know what you don't know. And I won't let you kill anybody, but I have to know what you don't know. And if you don't tell me, I can't help you. So you've got to talk to me. And the only thing I will ever get truly upset about is if you say you know something and then something negative comes of it. Just be honest with me, because that's the only time what's upsetting to me is if we could have prevented something, we just got to be honest with each other. And that's what I want you to succeed in this, no matter what. And I take this super seriously. So I'm here to be whatever resource you need.
Yeah, totally.
So I think just, if you need me to slow down, stop talking, talk more, let's just be open and honest with each other, because that's the best way it can work.
Yeah. I agree with that. And you're describing trust.
Yeah.
I need to build trust with you. And if you front with me, which is really lying, you represented yourself in a way that was not truthful. And there's no need to do that. Like, we're all here to learn. We're all here to just start where we are and go from there. So that actually breaks trust with me. And then it makes it hard for me to really help you where you need help, because you told me you knew this stuff.
And I trusted you. So
now we're not on the same page. Also, the one thing I want to say about your example of teaching the platelets and the plasma, and gosh, they can get mixed up for sure, is like anytime, we're going to get it wrong. Let's just start there. We are humans. Like, we're going to mix stuff up. We're going to be sympathetically activated in front of whatever situation and say something wrong. And you know how your brain plays that trick on you where you think you're saying this, but what came out of your mouth was something else. It happens to me. I know it does. So it's not when you fail or get it wrong, if that's, whatever term you connect with it, but it's or if you will, sorry. See, I just did it right there. It's not, hey, if I get this wrong. No, it's when you get it wrong. Why? Because you will. And you're not perfect, and that's okay. And, like you were saying, Jeanette, I don't expect you to be perfect. I don't expect you to know everything. I don't expect you to remember everything. The beauty and the art and the science of nursing is knowing where to resource information, when to look it up. And it's not just knowing values of information, but how to synthesize it, right? That's what matters. So just laying it out there for them and making it a psychologically safe environment, letting them know that you've gotten it wrong at times. You shared those stories of med error. Allie, when you were talking about, or no, Jeanette, when you were talking about organizing the room, I remember witnessing a code that it was my friend's patient that it happened to. And he did okay. But at the end of the code, the feedback for my friend, it was her patient, from the charge nurse at the time, was some pretty, it was tough for her to take. It was feedback about how unorganized her room was. And because her room was so unorganized, we couldn't find the ambu bag. Well, it's pretty dang important at times, such as a code. And the charge nurse, he was kind of keyed up. And so he gave her the feedback, I felt like, in a way that was shaming to her. And that is really how she took it. It really hurt her. And so he's giving a piece of constructive feedback, but he's doing it in the wrong way. And because of it, all she hears from him is, you think I'm stupid, you think I'm a bad nurse, and you think I can't do my job. Versus, I need you to have your room clean and organized because I couldn't find the ambu bag when I needed to bag the patient. And so, like, choosing the timing, choosing the spirit in which you give that information, and being clear on your intentions from the beginning. If you are keyed up and frustrated, that is going to come through in your words. So press pause. Don't give that feedback right then. Give it in a time and a space when you can be like, oh, that was a lot. Man, how you doing? We just went through it. What's going on? Let's check in. Allie, did you have something there?
No, I was just going to say, just recently I had a very heated situation, or I was heated, I should say, on a few things that went wrong in a patient room when I was covering someone who was orienting for a break, and they had come back from break, and I knew that I was still heated about because it was multiple things. And I just said, I'll take over, I'll finish in here and then I'll come find you. And just kind of had to make sure that I was in a good headspace before I provided feedback, and kind of had that crucial conversation, because in that very moment when the person showed back up, they had no idea what was going on. They just got back from lunch. So I think just being mindful of like your presence and your where your frame of mind is. And I got out of the room. I, went to the bathroom, walked around the unit, and then was like, okay, I'm ready. So just taking that time for yourself and being able to, it's okay. Things are upsetting at times, but like, don't bark at somebody when you're right in that moment.
Yeah. Don't bite them.
It's not productive.
Nope. All right. But we do want to talk about those times that it's not going well. So that was a great segue, Allie. Thanks for that. So the side of the mountain is getting bigger out the mirror, or out the window, excuse me. So when it's not going well, when the trajectory of the shift, of the interaction, the conversation, whatever it is, the segment of time, big or small, it's not going well, you may have just witnessed something that was unsafe, not okay, or maybe you had to do a safety stop and say, hey, whoa, let's pause. Don't do that. That's not a good idea. Knowing your resources. So knowing that you can always press pause. You can always, or if it's already happened, the behavior had already happened, you can say, hey, your example, Allie, hey, why don't you go ahead and go to lunch, and let's check in after this. And then during that time that they're away, if you need to, call the manager, whoever the right chain of command is to address the issue. What I want to offer you at this part of our conversation is, and we'll talk more about it in person. We only have a few more minutes left, but it's important to know that you don't just have to keep a brave face and get through it. I don't want you to do that. I want you to know that you always have backup in me, in your manager, in a colleague, in somebody. You are not in this alone as a preceptor. And so if something's going on and you're like, hey, so this just went down, what do we do? And now your mind is like, we're in damage control and we need to do some service recovery with the family. We need to fix the error. We need to call the doctor. Like, we got to do all these things. Don't be alone in that, because you're not alone. So don't take it on. Also, there are times, for different process components where you got to take somebody out of service. That's a really hard thing to do. It's been an unfortunate experience of mine on rare occasion. And I would just say, this is where you really need to know your crew. Like, you reach out to those resources sooner, not later. Don't let it get so unraveled and so bad and so confusing and frustrated and emotional that you can't come back from it. And also, you protect each other by saying, hey, right now, legally, we need to pause. I need to have you not go back in that patient room. There was an accusation that was made. There was, whatever the issue is, that's actually a good example. Hey, I come into a room, the patient says, hey, that person that was here before you, they did these things. And those things that they're reporting to you are illegal, actionable, whatever the issue is. There's a process for all this. And so without getting into a lot of specifics now, I would just say, know your policy, including the compliance policy, risk policy, standards of care. And if you're not really familiar with those, that's okay, right? It's okay to look stuff up. It's okay to reach out to people like me and your manager and say, hey, help me out. I don't know what to do here. So just know that as a preceptor, you're going to see a lot of stuff, and you're not alone. So now's a good time to think about what those resources are. We're going to be talking about some of them in the in-person classes, but certainly don't be alone. And if you feel like you can't tell anybody, like that other person says to you, don't tell anybody that this happened. It's so embarrassing. I can't come back from this or whatever. Nope, that's shame, and don't stay in it. It's not safe. It's not safe for you or them. All right, we only have a few more minutes left. So I want to touch on, I know we're going to be talking about this a lot, but the novice to expert continuum, we'll be going into this more in our next virtual conversation. But as far as, giving feedback in a way that is in context of this, and that, right away they might be mimicking you, they might be in that novice place, how do you move them along this continuum? Jeanette, we got a few minutes. Is there anything you wanted to offer that?
Yeah, I think we are adjusting some of our feedback review forms to mimic this novice to expert continuum. We have heard that it's really difficult to give feedback. So what we're trying to do is make areas in which should be more concrete, black and white, like did you or did you not do your standards of care documentation? Have you or have you not had experience with a ventilator? If so, is it your first time with a ventilator, i.e. are you a novice versus now you're towards the end of your critical care experience and we're expecting you to be more proficient with a ventilator. We're trying to give you this continuum because, you know, rather than you're bad or you're good or this has a little bit more of a expectation for the appropriate curve that a new intern should be on. So reviewing this novice to expert continuum and understanding that this is now where we're going to try to evaluate folks on, I think will make giving feedback easier and a little kinder, like saying, you know, you are an advanced beginner because you have only seen a ventilator twice. I don't expect you to be proficient at it right now versus before it was like, what was the feedback model before, Kristen?
It was like given training.
Progressing, not progressing, given training, not observed.
Yeah. So it's basically like you're not progressing, but that is a little bit too, it feels a little bit too crude and too mean.
It's too limiting.
Almost. It's too limiting.
Yeah.
So this scale should make your feedback a little kinder and a little bit more on the expected curve that interns should be on.
Yeah. And we, we want your feedback about our feedback tools. So like Jeanette said, the expert to novice continuum, it's on the paper forms. We have actually virtualized the paper forms for those of you that want an electronic virtual option and just to make it easier for you. But definitely we will be circling back to this a lot. And also, we're going to be talking about a few other models in that novice to expert continuum. We have a few things we're going to be talking about in our next session of, hey, there's the married state of precepting model where we're always next to each other. We're always in each other's business and watching and demonstrating and learning and talking. And then through that novice to expert lens of now they're growing and now they're an advanced beginner and they're competent and or they're proficient or they're an expert. We're going to move into a model called a tiered skills acquisition model, and we will give you more information about that in our next session. But just so you know what is to come, and this is what we'll be moving into. This will be the future of how we precept here at Kaiser Sunnyside. We're going to be going from always being stuck in that married state to advancing through the expert to novice continuum. So until our next session, thanks you guys for watching, and we'll see you next time.
Thank you.
Bye.
Bye.